In the Society for Participatory Medicine, we talk about e-patients as being patients who are empowered, engaged, equipped, and enabled. Now, as patient empowerment and engagement have become more of an active part of health practice and policy in recent years, I've found that a lot of people are starting to wonder, what do we really mean by this? I mean, to some people, talking about patient empowerment really is just sort of a warm, fuzzy, let's be nice to the pretty patients and healthcare will automatically get better. But I have more of an engineering mind. I want to understand functionally, what are we really talking about here? You could say, what's the mechanism of action by which these interventions produce results? And as it happens, in my travels in the last few years, I've encountered some useful definitions that interestingly come from outside of healthcare, and I'd like to share them here. Now, first on empowerment, at the World Parkinson's Congress in Montreal in 2013, I saw the most useful definition I've ever seen. And not surprisingly, it was presented by a patient, not by a professional in the industry. Here it is, and wait till you see where it comes from. Empowerment for this group is defined as increasing the capacity of individuals or groups to make choices about what they want. So if they can't do that, they have no power, right? They're powerless. And then to transform those choices into desired actions and outcomes. In other words, to make up your mind about what's important to you, and then to be able to take effective action. That is empowering when you increase people's capacity to do this. This definition is from the World Bank, which has been using it for more than 10 years when they go into a developing nation where the citizens initially don't have any capacity to grow an economy, develop their own government, and so on. And this is where the idea of capacity building exercises comes in. So for patient empowerment, what we want to do is increase the patient's capacity to make choices and transform those choices into actions. Now, with this definition, you can easily evaluate a proposed intervention as to whether it's empowering or disempowering. If we give patients access to their medical records, will it improve their capacity to take effective action? Obviously, because if you take access away from them, they'll be less able to do that. See how this works? Now, engagement and participation are more subtle. I have discovered a couple of years ago Arnstein's ladder of citizen participation, which interestingly came out of President Johnson's Department of HUD, Housing and Urban Development, back then. In the early days of urban planning, urban planners would decide, all right, we're going to tear down this building and put through a freeway. But then it turns out the citizens didn't always like that. And the question became, given that the ordinary people who live in a neighborhood don't know everything, supposedly, that the people in HUD knew, how do you work your way up through this ladder of participation? These slides are adapted from Catherine Girard at the University of Syracuse. The original Arnstein's ladder has 8 rungs of not starting from non-participation at the bottom up to tokenism, where, for instance, in the 60s and 70s, we talk about having a token woman on the board of directors, a token citizen, perhaps, on the development board. And then at the top, you actually get into where the citizens actually have powers. We're going to look at how this applies to patient engagement, patient participation as well. So Girard simplified this from the 5 levels down, from the 8 levels down to 5. And at this level, the lowest level, now the larger circle here is the person who has the power and is making the decisions. You can see that this would apply in the clinical visit as well as in things like, for instance, in Massachusetts in the United States, we have PFACs, Patient and Family Advisory Councils. In the early days, it's common for the PFAC to come in and essentially get a presentation on, here's what we're doing. And everybody has milk and cookies and goes home happy. You are being informed. The next level up is where the people who do the presentation start to ask, what do you think about what we're doing? See, they're still the ones, and I'm sure everyone listening to this at one time or another has been in some sort of a meeting where you either get talked at or you start to get feedback. The next level up is when the people who are going to be stuck with the decisions start to be involved in the process. And so, for instance, the people running things might say, here's what we want to do, here's what, and the others, the residents, if you will, or the patients will say, well, here's what we think about that. Now, here's why this is important, this consult level. This is an all too common situation. The urban planners or whoever it might be have designed and built this gorgeous sidewalk, clearly very nicely done with paving stones and so on. When in reality, when it's finally open for use, here's what happens. Now, some people, design thinkers, call these desire lines, where the people, the users, actually start to express where they actually wanted to go. And see, if you can just start by involving the people who have the need in the first place in the process, you can take all that great architectural and construction skill and apply it in the first place to something people love. We want to make this contribution to the future of healthcare. Involve us. Let us help us define what the objectives are. The next level up is when there's full collaboration. Here you can see the people who will be the users of the system, the ultimate stakeholders, are actively involved. And the top level is where the citizens are actually calling the shots. You don't often see this in reality because the people who have the power completely give it up. Now, there's an important distinction here. I commonly hear people say, well, it would be great if I had this kind of patients, but my patients are all just like down here. They just want to be told what to do. Well, let's go back now to the definition of empowerment. Indeed, if somebody starts here, if you hear them say, well, I don't know, you're the doctor, you tell me. If you want to work together toward this fuller expression of full citizen participation, what you need to do is increase their capacity to make choices and then to take effective action. And that's how we grow the total amount of competence in the whole system, when we empower and move people up the ladder of citizen participation. You know, where this is going to really be important is as we all work toward accountable care, value-based care, and especially in my generation, the baby boomers, as we are moving into the elder generation, there's going to be a lot of us, and the system is really not prepared to cope with all of us. So please, let patients help. Let's work together to figure out how to move up this ladder in participatory medicine. Thanks for your time.